In recent years, healthcare has become a subject of much debate and controversy in the United States of America. There are rising tensions between different social groups and different economic classes over whether health insurance should be a market commodity or a basic right for all citizens. When confronted with this question, many adults argue that people should work to be eligible for health care and that guaranteeing all Americans health care will decrease the quality and availability of health care in the United States. On the other hand, the United Nations Universal Declaration of Human Rights lists medical care among the basic human rights to which all people are entitled. Currently, the side advocating the right to universal health coverage is leading the debate. Millions of Americans are either uninsured or ineligible for health insurance. The Henry J. Kaiser Family Foundation says that 47 million Americans did not have health coverage in 2012. Many of them are unemployed and therefore do not have work coverage. As a consequence, these people do not receive preventive care and services for major health conditions and chronic diseases. If they experience even the slightest of symptoms, their only option is to go to the emergency room. This ends up costing an exorbitant fee. The goal of the government is to make health coverage more affordable for everybody without decreasing its quality. The topic of universal health coverage has been discussed since the early 20th century. The first proposal appeared in 1915 and was submitted to Congress, but the nation was primarily focused on World War I at the time. The Blue Cross, founded in 1929, was the first private health insurer. In 1935, the government instituted the Agricultural Workers' Health Association, which provided preventive medicine and acute care to migrant workers. President Lyndon Johnson passed the Social Security Act of 1965, establishing the public health care beneficiaries known as Medicare and Medicaid. Today, new policies are in progress in order to ensure universal coverage for the citizens of the U.S. Barack Obama is the main driving force behind these policies. On March 23, 2010, President Obama passed the Patient Protection and Affordable Care Act that increased health care coverage to include 32 million previously uninsured Americans. 95% of Americans are insured under this new law. The United States spends more money per capita on health care than any other industrialized nation, over $2.3 trillion. The irony is that much of the world's cutting-edge research in genetics, pharmaceuticals, and technology occurs in the United States, yet it is the only wealthy industrialized nation that does not offer some form of healthcare to all of its citizens. The arguments of those against universal healthcare coverage are focused around potential for increased government debt and financial burdens for taxpayers. Regarding Obamacare, objections accuse the plan of being socialist because it called for using tax revenue to fund health insurance for those who cannot afford it. Similarly, those who oppose socialism also argue that universal healthcare would decrease the quality and availability of healthcare for those who work hard to get medical coverage. In reality, giving everybody access to healthcare would directly result in a nationwide improvement of public health, an increase in life expectancy, and a decrease in infant mortality. This is evident in other nations, such as Great Britain, Scandinavia, and the countries of the former Soviet Union, where the government controls almost all access of healthcare, and in Germany and France, who guarantee insurance for almost all of their citizens. The U.S. is different. Health insurance runs off of a pool of resources that creates a common fund from which members can access money when they need it. Each person has to pay a monthly premium to cover the medical expenses of the others in the fund. The costs of living without health insurance are extremely difficult to cope with. Healthcare has proven itself to be one of the most widely debated topics in the world, let alone the United States. Everybody should have the right to medical services and have the ability to afford health care. Universal health coverage will not decrease the quality of health insurance, but help the population as a whole become healthier and happier. The benefits highly outweigh the consequences. Health care should be a basic right entitled to all citizens.